The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Huber. Dr. Huber, welcome to the program.
Thank you, Randy. Pleasure to be here.
All right, now before we get into today's topic, you brought some models and photos, and these are very graphic photos, by the way.
Some of them. Yeah.
So they're good. They're good. Tell us a little bit about your practice, by the way. What are the kind of procedures? I mean, we're talking about dental implants today, but your practice.
I practice in South Burlington, Vermont. The practice has been established for over 40 years. I've been practicing for about 14 years.
Okay.
We offer a full range of periodontal services, from treating periodontal disease, the infection, to cosmetic periodontal procedures, to replacing missing teeth via dental implants.
Okay.
We help people that gums are too gummy, people that want to cover exposed roots, people that just need some good maintenance and cleanings, and generally help people feel better about themselves and their smiles.
Now, we talked a little bit on the phone, but I guess with as little as 2 dental implants for a denture wear,
yes,
you could give them something that snaps in, snaps out, like a fixed set of teeth or a full set of teeth.
Absolutely. Dental implants were developed specifically to help people who wear dentures, not to replace single teeth, which they can do now. They become more versatile, but that's initially why they were developed. People who wear lower dentures have a very, very difficult time. They don't fit well no matter how well they're made. They're limited. They move around. They're not very what we call tight or retentive.
So is there such thing as a happy denture wear, by the way? Well, I know people with dentures, they don't complain about their dentures.
They don't complain because it's embarrassing, perhaps. I mean, you really have to know somebody well for them to complain about it. They manage, they adapt,
all right,
at best. But it is a very difficult appliance to wear in your mouth. It moves around. There's nothing really holding it. Even the best fitting denture without any extra help from a couple of implants, say, you're really limited in what you can eat. I mean, you go to a restaurant and it's not what you can order, it's what you can physically eat without embarrassing yourself.
Okay.
Food can get underneath.
Did they tell you this, by the way?
Absolutely. Patients who come in?
Yeah.
Sure, absolutely.
That they go to restaurants and they've got to worry about
once you get, they don't go out sometimes, they avoid social situations, they have to wear adhesive constantly, it's a gook that they have to spray, it's a big industry. I mean, you watch the evening news, you'll see commercials for denture adhesive, there's a lot of people using that product, which, by the way, there have been some studies recently showing there's a lot of zinc in that product. You can get possibly zinc poisoning as well as various neuropathies from it in heavy usage. So under the best of circumstances, Randy, they adapt and they manage.
So in the future, would you say that, when you hear terms like no more dentures, do you think that that's the future? Where every denture will be fixed by
there won't be more dentures, but there'll be implant-supported dentures. Yeah, and we're seeing that in Europe. Some governments under the socialized medicine plan, for example, are providing their seniors 2 dental implants. It completely changes their quality of life. They can eat, chew, go out, talk, smile.
And it's not painful, by the way?
Absolutely.
How is it not painful? I mean, because you're going into
you're going to the bone. When you describe to someone, you say, oh my gosh, that must really hurt. But people need to realize that the nerve endings or nerve tissue, the parts a little sensitive, is in the gum, which is a thin layer covering over the bone or the jawbone. The jaw does not have nerves in it. It is a very atraumatic outpatient office procedure to put 2 dental implants in.
So pain is not something they complain about?
Absolutely not. We can say that across the board.
Okay.
Very commonly, they'll take over-the-counter medications, maybe a Advil, a ibuprofen product. Some people take Tylenol or an aspirin, whatever they prefer.
What are the age ranges of people that are coming in for dental implants?
Well, we'll say what age ranges are not. Under 16 or 17, that's not an age range. Anything beyond that, Randy, 6 months ago, we treated a 90-year-old.
For dental implants?
A 90-year-old gentleman came in.
Why would a 90-year-old want to do that?
Do you like eating?
Yeah.
This gentleman likes eating. Absolutely. He wants a good quality of life. He was fed up. He lost his teeth, unfortunately, and had a miserable time with his dentures. They no matter how well they're made, they move, they can clack.
So you're not too old at 90.
You're absolutely not too old.
Is that
and
right?
he is thrilled. He comes in, and my staff loves him. He's a cute gentleman, and he kids with them. And boy, did this change his life. I mean, he goes out and eats what he wants.
For the denture wear, is this one of those things where they say, I should have done this years ago?
Without a doubt. They don't know. Sometimes, like I mentioned previously, they adapt, they manage. They don't know what they're missing. They can function almost like natural teeth.
Would you say there's tens of thousands of people in your area, in your state, that are wearing dentures, upper or lower?
There's an interesting statistic.
But if
Okay,
it's as good,
25% of the people over 65 in this country don't have teeth.
Okay.
That's significant.
I heard 20 million people for sure have either an upper or lower.
25% of people over 65 years of age in this country
But if
don't
it's
have
so
teeth.
good, why aren't they all doing it?
They're either afraid of it, not aware of it.
Because why? They don't go to the dentist, the denture wearers.
Look who the denture wearers are. Exactly.
Interesting.
They don't go to the dentist. They've lost their teeth maybe years ago. And they'll go to the dentist when a tooth falls out. They break a tooth off their denture. If it snaps in half, they'll get it repaired. But they don't go regularly to the dentist. And these advances are made. Or they feel they're too old, like you mentioned. Ratifying thing to do.
Is this the happiest group of patients in all dentistry? The patient that has a denture that now they get it fixed, or
definitely in the top 2 or 3 for sure.
With implants?
I mean, absolutely.
So what are the categories of dental implants?
Categories of dental implant patients, it's a wide range. We can start with somebody who's, say, missing a tooth congenitally. Okay, they're just born without certain teeth, and they can get an implant replaced. How about a trauma patient? Okay, somebody's in an accident. Okay, knocks some teeth out. Those are great dental implant candidates. Traditional dentistry, which perhaps has starting to fail, that can be replaced with dental implants. People who wear partial dentures, in other words, Randy, they're missing some of their teeth, but not all of them, and they're wearing a denture which replaces those teeth.
Okay.
Okay. So typically, those will have little hooks or wires which go around the natural teeth, and those can be loose as well. With 1 or 2 implants, those can snap in almost like a boat snap,
so they don't
move at all. They'll come in and out, but it'll take some force.
Okay.
Okay, in other words, they won't move around, and it'll put less stress on their natural teeth. Those wires or hooks of these partial dentures, over time, put a lot of stress on the anchor teeth. And with the help of dental implants, it takes the stress off the anchor teeth. Consequently, they can keep their natural teeth much longer and have a denture which fits and is much less likely to get food underneath and involved with falling out or embarrassing situations. And then, of course, as we discussed, we have the people without any teeth, especially on the lower, where it's really a game changer for them completely. And on the upper, which do stay in better because there's suction
for
on
dentures.
The upper, for dentures, you know, you'll talk to most upper denture, they adapt very well. The lowers, they don't really adapt that well, but if you talk to a lot of people, their upper denture they can adapt to. However, with the addition of, say, 4 dental implants on the top, they can have a much smaller denture which does not cover the roof of their mouth.
Interesting.
Taste buds are on the roof of the mouth. They start tasting food a little better. They start speaking a little better because the tongue
so just 4
is not as
implants,
restricted.
you give somebody
just 4 implants, you
that's
can go
fixed?
It's snap in, snap out.
Okay.
4 implants on top, and they can start tasting food and just much more comfortable. It's a smaller appliance.
So backing up to the 1 tooth, what's the advantage of getting a dental implant when you're missing just 1 tooth?
The advantages are tremendous. Let me explain, Randy. Here's a model. Obviously a missing tooth in the center. What are our choices here?
Yeah.
Traditional dentistry, the teeth, the adjacent neighboring teeth, can be cut down or pared down, and something called a bridge can be placed on top to replace these teeth.
And that's how it's normally done?
Well, it was normally done.
Okay.
Okay. And there's really nothing wrong with this, but we could do better. Why can we do better? When you pare down teeth, it opens up, it turns a 1-tooth problem into now a 3-tooth problem.
Okay.
What do I mean by that? The anchor teeth, okay, are now susceptible to decay, periodontal breakdown, in other words, gum disease. Why? Because you can't get in there to clean. When you take floss, this is all connected. The only way to clean down here is to put floss underneath, which is time consuming. And if most patients are frank with you, they'll tell you they neglect it a lot. The average lifespan of a bridge is about 10 years, according to the American Dental Association.
Is that right?
Of course, some will last longer, some will last less. I wouldn't call it patchwork.
But it is in a way, if it only lasts 10 years.
If you want to call it patchwork, fine.
Okay.
But, you know, but it is it's permanent, it goes in and out. It worked well for a while, but we can do better. Why not leave those adjacent teeth alone?
So don't carve down the teeth.
Don't carve down the teeth at all. Put an implant in, which is a simple, painless office procedure, and have a tooth and leave the adjacent teeth alone.
Interesting.
You know who gets excited about this in our office? The engineers. They really understand. We have a lot of engineers who work in a high-tech area.
All right.
They love everything about the implants, including the little toolbox that we use. Okay.
So do you think that this prevents future tooth loss? I mean, obviously, you know, the 20 million people on the internet.
Absolutely. Because what happens when you have, because what happens when that 3-tooth bridge fails? what are you going to do? 4 teeth, 5 teeth? It's sort of like a domino
Does the
effect.
mouth tend to collapse?
It can.
When you have holes in the mouth?
When you not replace missing teeth, sure.
Okay.
Upper teeth can shift, upper teeth can come down, lower teeth can come up, teeth can start moving forward, you can start getting crooked teeth. It creates a cascade of events over time. It's not going to happen immediately, but sure, over time, and it can lead to bigger problems.
I mean, if you're missing a tooth, get a dental implant. It's like getting your tooth back.
That's the way I would do it.
All right, all right. What's the next category then?
Okay. Next category is, let's say you're missing multiple teeth in an area, okay? Right. So for one reason or another, you've lost a few teeth. See, it's interesting, Randy, a lot of people think it's an implant per tooth.
It's not that way?
It doesn't have to be that way. It can be. It doesn't have to be. Obviously, if you're missing one tooth, yes, it's one implant. But here's a situation where you're missing 3 teeth. So what do we do with the 3-tooth situation?
What?
Put in 2 implants.
Okay, okay.
And so like 3 teeth to go on top. So this is an implant bridge is what it's called. So these are back teeth.
And, they don't, and that doesn't come out?
Does not come out.
Okay.
Part of them stays in. And it's the longest lasting solution dentistry has to offer. These implants, they don't decay. They're less susceptible to periodontal breakdown than natural teeth.
But what about somebody that has bad gums, by the way? They're missing a few teeth. Their general dentist has told them their teeth have to go. I know someone like this, I was telling you, that it was dentures, dental implants. They said their gums are too bad. Well, can they get dental implants?
Absolutely.
If they have bad gums?
Absolutely. The reason they have bad gums is because they have bad teeth. So a couple of options. You can either try treating the teeth and improving the state of the gums. In other words, if you're not going to be losing... The teeth have to go. Once the teeth are gone, the infection's gone. And now we're basically starting over.
The infection goes away.
The infection goes away. You can even put the implants in the same day the teeth come out. We do that routinely.
Is that right?
Absolutely. It's a wonderful service.
So when I hear things like teeth in a day or implants that day.
Not in every situation, Randy, but absolutely.
But that's possible.
It's possible. We do situations for the single tooth where somebody, unfortunately is in an accident, knocks a tooth out or it breaks at the most inopportune time. We have business people come in. We do this every day.
Can you match them up looking pretty good, by the way, like the front teeth?
Absolutely. You can match them up very good. Yes.
Okay.
We put the implant in. They go back to their general dentist or restorative dentist, and they can put a temporary crown directly on the implant, avoiding the need for something which comes in and out or removable. Okay. It's a great service, especially for people in the public, because those removable appliances often can be hard to wear. So there's many different options which are made.
So next category is what? Next category, and then we're going to take a quick break.
Next category are people with full dentures, missing all of their teeth. So on an upper, for example, this is exactly what I was talking about. We were talking earlier about having 4 implants on a full upper. In a conventional upper denture, this whole palate or roof of the mouth would be covered.
So this is actually what it looks like?
This is exactly what it looks like, Randy.
So underneath here, this snaps on.
It snaps in and out.
And then underneath,
those are little receptacles, little fittings, if you will. And we don't call that, it's not fixed. Fixed is when it does, only the dentist takes it in or out, really. Okay, which can be done, but you would need 6 on top.
So 4 on the top.
4 on the top, you get something removable. Eliminates the roof of the mouth, big advantage.
And they could eat like corn?
Absolutely. Bite into apples. Taste food better. The taste is a big thing. I'm a foodie. I like food. I like eating, and to enjoy the taste and flavors of food and to eat,
or wine,
and be comfortable, and wine. Not too much, you'll stain them. But no, you can drink wine. Just keep them clean. Is a wonderful thing. But the single biggest, and of course we talked earlier about the partial denture patient. Some teeth, not all. You can add an implant or 2 to make your partial denture, which is removable, more retentive or tighter, and take the stress off the natural teeth. I don't have a model of that. But the biggest single indication, Randy, is for the lower denture wearer. In my opinion, this is the standard of care, and everybody who has a lower denture.
Let me see this. Now, is this
have a look at this. This is the way it feels. Randy, you try to take that off. Yep.
Okay. This is not a setup either.
Not a setup.
This is really that hard? I mean, how do they get it out of their mouth?
Some people, the biggest complaint they have is it's too tight.
Greasy.
Well, what you have to do is take it from the back, really. There's a way. It's interesting. Yeah.
Okay.
What's he going to show you?
We're going to show me that on purpose.
But listen to this. This is what it sounds like. Did you hear that?
Nice.
It's a click. And then they don't move.
So there's no... Okay, so a denture wearer watching this can go in, they get imaging. How long... I mean, what's the turnaround time where they get... And are they ever left without teeth?
They're never left without teeth.
Okay. But what could be the turnaround time in a perfect world? Somebody watching this, they're wearing a lower denture.
Sure.
With this snap in, snap out, how soon could they get their teeth?
They come in to see us, we do a consultation, we take the necessary diagnostic records, review the history, set the patient up for the procedure. Say the procedure is done today. Typically, 6 to 8 weeks following the placement of the dental implants, they can be used, or they're ready, the bone is healed around them, so they can be used to support the denture. We work in conjunction with restorative dentists, general dentists, and prosthodontists. Okay, 99% of our patients come to us by referral.
So they don't have to. They don't have to switch dentists to go to you for.
They don't have to switch dentists. They don't have to have a dentist.
Because you're going to work with their dentist.
We work closely with their dentist.
Okay.
Absolutely. And then after the 6-week period or 8-week period, they go back to their dentist. Their dentist has 2 choices. If it's a well-fitting, well-made denture, they could retrofit their existing denture.
Use their same denture.
Use their same denture.
Okay.
In the office, put in the receptacles, and use them that day. Sometimes, though, the dentist prefers to make a new denture, especially if it's a particularly old one.
So the people that are wearing dentures, okay, so 6 weeks from now they could get
6 weeks they could. If they need a new denture,
but they can
probably
wear their old
month.
denture while
during the
that's
healing
being
period.
done.
They're never left without teeth.
Okay, good.
Yeah.
Good.
Following,
Now, we're going to take a quick break.
Sure.
Because I know you have photos
Yes.
and more questions about the options for denture wears. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more information for denture wears. We'll be right back.
I've had a tooth extraction and an implant, and it has all gone amazingly smoothly. I will be happy. I think cutting your teeth is about the most important thing you can have, and you need them all. So I can't say enough about the staff here, as well as Dr. Huber. They're compassionate, humorous, and this has all been much easier than I thought. I'm a happy camper.
The implant procedure was quick. I was out in an hour. Had very little pain, and even afterwards there was no aches, or everything was cleared up by the next day. I would certainly recommend it. It's easy and quick, and certainly none of the fears that I had going in came to fruition.
Right now, I can chew on both sides of my mouth, and I can eat almost anything. And I would do this again in a minute.
If I can now eat without any pain, and I can drink hot, cold, makes no difference. And as far as having it done again, I do it in a moment's notice.
Hi, I'm Randy Alvarez, host of the Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. What you need to know if you're considering dental implants. My guest says no more dentures. That you can get a snap for denture wears, just 2 dental implants to get something snap in, snap out. Is that right?
That's correct.
Okay, now if there was a try-in period, like let's say on a Friday, if it was possible, denture wearers come in, try it in, do you think on Monday they could ever go back to their...
Never. I would love to have a try-in period, okay? We've
that's
been doing
real. I mean, they couldn't go back.
It's
really?
day and night. It's day and night, Randy. We've been doing implants for quite a few years. Like I said, 14 years I've been there. Nobody has come back to the office and say, would you please take this out for me? I don't like it.
Okay.
Really, they're beautiful. They work great, especially for denture wearers. It's a life-changing event for them.
So 2 dental implants. Because it's interesting, like you say, you count your teeth and you think you need that many dental implants, but just 2 implants will completely change their life.
Exactly. That's one of the misconceptions. Yeah, if you're wearing a full denture, 2 implants.
Now, what about fixed? And what if somebody wants something fixed in their mouth?
Absolutely.
How many implants?
Could do that too. Well, first of all, when fixed, we're talking about something which only the dentist can take in or out. It's screwed in. You're looking at least 4 to 6 implants per jaw if you're looking at a fixed option. Every case is different, and that's great for some people. They don't want anything removable whatsoever, and that's an individual preference.
So it's like getting your teeth back.
It's exactly
they feel normal,
like getting your teeth back. You don't have the same what we call proprioception as a tooth. In other words, you don't get, which is good, you don't get toothaches, you can't feel it moving a little bit, you don't have the cold and the hot. So it's slightly different. I don't have implants, but according, talking with my patients, but it's as close as we can possibly get to getting your full set of teeth back. And again, as we mentioned, it's not painful. They don't decay. They're not going to need root canals.
Are patients surprised that there's no pain?
Extremely surprised, and they never, ever believe us during the consultation. I even leave the room, and the staff member talks to the patient. Typically, we do a lot of, taking teeth out and then replacing it with dental implants. And if we don't do it right away, because sometimes we could take a tooth out and put the implant in the same day. Sometimes we do it in a phased approach for various reasons.
And the bone doesn't have feeling, so they don't feel.
The bone doesn't have feeling, but taking the tooth out, although that's not, it's not the most pleasant thing in the world, but we always tell them that that's going to be the more traumatic event for you, as opposed to putting the implant in. Especially when we show them the models, which we show them, which are oversized implants. Yeah, they're very small. Yeah, I mean, an actual implant, Randy.
It's so tiny.
Just think of it as taking the place of a root of a tooth. Here's a nice representation of a root of a tooth compared to what a dental implant looks like.
It's very small.
Yeah. That's all it is. Usually about 10 or 12 millimeters in length. And
so it's virtually like a bloodless procedure in some cases?
Virtually, yeah. It's very atraumatic. It really is, and it's very well accepted. Very little discomfort,